There is a GP shortage in Australia. It's caused by a couple of major factors. One is fewer medical students when they graduate choosing to go down the GP pathway, but particularly in the regions, it's because we usually rely on a lot of migrant doctors who haven't been coming during COVID. Labor has been talking about this in particular in opposition. In government, it says it will address this. So how will it do so? Joining me live is Assistant Minister for Rural and Regional Health, Emma McBride. Thanks very much for your time. You've been meeting with a lot of local community groups, including GPs themselves. What are they saying is needed to address this shortage, and how bad is it?
This is a problem that is apparent across Australia. I've been meeting with local communities, Launceston in Tasmania, Townsville in far north Queensland. I'm here in Mildura in Victoria today. And what I'm hearing is it's never been harder or more expensive to see a doctor. And this isn't something that's just happened. This is a result of the almost decade of neglect of the former government. And it's something that, as the Assistant Minister for Rural and Regional Health, that I'm determined, working with GPs, working with nurse practitioners, working with allied health workers to turn around. It can't be that someone living in the most rural part of Australia has a 19-year less life expectancy than someone living in a metro. And this is something that is a widespread problem. It starts in the outer suburbs and continues across regional and is felt most acutely in rural Australia.
One core demand from GPs of all stripes, it seems, and doctors' groups is the Medicare rebate per appointment. That's fallen as a percentage over quite a number of years now. It was frozen, but the point is the percent that is rebated has dropped again and again and again. Is that why bulk billing in particular, and even the GP numbers out there, has dropped? Do you agree with that as a basic premise?
There are lots of contributing factors to the GP shortage. And as I mentioned, this has happened over a decade of the former government. Minister Butler, the health minister, stood up the Strengthening Medicare Task Force not long after the election, because this is one of the top priorities of our government. And those recommendations from the Strengthening Medicare Task Force are going through the budget process and will be backed in by our $750 million Strengthening Medicare Fund. There are many contributing factors, and we need a coordinated and well thought out response to be able to make a genuine change to the health outcomes of people living in rural and regional Australia.
Right, and so what you're saying is one thing won't fix this issue, but money's a pretty important one, whether we like it or not. So do you agree that there is a basic core issue here, that rebate, the fact it's been going down in real terms, is a key factor to the issue we're seeing in terms of GP shortages, and not just GP shortages, but bulk billing falling off as well?
Well, the Medicare rebate freeze that we saw under the former government has, yes, contributed to this problem. And it's one of the considerations of the Strengthening Medicare Task Force. And those recommendations are going through the budget process at the moment, and they will be backed in by the $750 million Strengthening Medicare Fund. But what I've heard around Australia is that there are lots of different solutions to these healthcare access and affordability problems that people see. Today in Mildura, I've heard from the local Murray PHN who are talking about nurse practitioners and the vital role and the expanded scope of practice that they can play. So there's lots of different solutions that we need to consider, but in a well-coordinated, integrated and thought-out response.
Yeah, and of course is what Mark Butler's spoken about, that you spread it through all the different people with medical expertise. You're a pharmacist, I'll note, who are going to have an increased role. So I understand you're saying that that's how you can get more healthcare to more Australians. But you mentioned going through the budget process. Yes, there's $750 million towards strengthening Medicare. That's not going to deliver some sort of big increase to the rebate, which would be a big ticket item. Is that something seriously on the table for the government, the sort of increase that might mean that bulk billing rates start going the other way, start going up, and people start taking up GP as an elective again?
Well, one thing that our government is being open and transparent about is the rates of bulk billing. These weren't available in real time under the former government. So we're being open and honest about the scale and the size of the problem. And I know the AMA and other advocacy groups have put forward this as part of a solution. And as I mentioned, the Strengthening Medicare Task Force, which included the AMA, included the medical colleges, have put forward solutions like this. The recommendations have come out of that are the best way that we can invest to improve accessibility and affordability, and they're going through the budget process.
And the issue, though, with that budget process is a pretty ruthless one right now. Is it fair to say that even amongst that, health is a pretty key priority for Labor, that in a budget where we're not going to see a lot of big new spending, there still is on the table perhaps a significant increase to the Medicare rebate?
Health is an absolute top priority for our government. Labor introduced Medicare. We've always fought for Medicare. For us, it's about universal healthcare, that no matter where you live, wherever you age, that you can get affordable and timely healthcare close to home. It's one of the main reasons I put up my hand to stand for Parliament. I'm a pharmacist. I worked in a regional hospital for almost 10 years. I saw the results of the former government's cuts and neglect, people turning up to emergency departments with avoidable conditions that could have been treated more safely for them through a GP. We are determined to turn around primary care, to improve people's health outcomes and to better support healthcare workers and our health system.
We had very few doctors arriving during COVID, of course, GPs arriving to the country. What's the situation now? Because there's the demand. Are they coming in the same numbers they were pre-COVID? Is there a bit of a lull? What can you tell us about that market, for want of a better word?
In terms of international medical doctors, and they have been a big part of our rural and regional healthcare workforce over many years, they are one of the top groups in terms of their processing through immigration. We know that in-country processes, including APRA and the colleges, are things that we are working to try to boost, but they are one of the top priorities for our government, and I've spoken to the relevant Minister for Immigration, Minister Giles, about this, and it's something that I've also spoken to my other cabinet colleagues about. So they're our absolute top priority. And we've also acted on distribution priority areas, which means that those international doctors are now available to a wider pool of communities who need them.
All right. Well, we'll find out more about the money available. As you say, that budget process is going on right now. Not long till we know. Assistant Minister Emma McBride. We'll talk after then. Thanks for your time.